Every day for 1 year, I went to a job that stressed me out. I would have headaches, I would have itchy skin, and I would cry every day. Every evening, I would call my sister and tell her how my day went. One day, when I called her, she asked me, why don't I try music therapy? I'd always knew that music helped calm you down, helped relax you. I always knew that, but I never considered using it as a form of therapy. She told me that at her physical therapy sessions that she goes to, there's another young lady there that's in the same position that she's in. My sister, she's paraplegic. She was in a car accident. And the young lady told her that she uses music therapy to help with just the emotional stress behind being in her situation. And it also helps with the physical, some of the physical pain that she has. They consider it as being phantom limb pain. So I started doing the therapy, and after probably about a week, 2 weeks, I started getting some results from it. I started just, being able to relax and being able to concentrate more on my work, figuring out how to do the job a little bit better, and having the right information to go and ask as far as to make the job a little bit easier and less stressful for me. Studies show that music has been known to have many positive effects on its listeners. In fact, there is a growing branch in medicine called music therapy, and it's on the rise. The concept of using music as a form of healing dates back to the days of Plato and Aristotle. But of the music therapy we know today started after World War I and World War II, when local musicians played for physical and emotionally traumatized veterans at the Veterans Hospital. And when doctors and nurses saw the positive response patients had, they request that musicians be hired to play in hospitals. A few facts. 4 out of 5 American workers describe their jobs as being very stressful. The World Health Organization recently declared that job stress has now become a worldwide epidemic. It is also estimated that 75 to 80% of all visits to primary care doctors in the U.S. are for stress-related complaints. Music therapy is being used in places of in place of pain medication, post-surgery to reduce the health risk with pain meds and for cost. Benefits of doing music therapy are it reduces the level of stress, better quality of sleep, improve healing and repair of your body, better blood pressure, and better concentration. It also reduces the frequency of headaches and migraines. Types of music to reduce stress the best: Native American, Celtic, Indian stringed instruments, and drums. Flutes are very effective at relaxing the mind also. So is light jazz and classical music. I would like to express once again how effective music therapy is for me and my family. I even do this with my oldest son. My oldest son is 9, and the school has made this year pretty stressful for him. He is now doing the FSA test, and with that FSA test, the teacher was telling the students how they wouldn't be able to go to the next grade if they didn't pass the test. And so my son, he took that to heart. He was coming home stressed out, talking about that he's not going to go to the next grade. What is he going to do? And it was just a big deal. So, as a mom, I went and I talked to the teacher. I just want to find out, why does she think that it's necessary to tell children that? Why is my 3rd grader stressed out? It just didn't make sense to me. So we got that all resolved, and I also started doing the music therapy with him too. It's something that he does when he gets out of school before starting his homework for 15 to 20 minutes. And then once he's getting laid down for bed, he listens a little bit longer. So I really encourage music therapy. I do not encourage it to substitute if you're taking any kind of medications from your primary care doctor or therapist due to any stress, but it can be something that can be added to it. Whatever you do with medication, any type of therapy, any type of treatment, just run it past your doctor. And I want to give some references of some websites that you can look at to find out some of the information I gave you plus more. We have PubMedHealth.com. There is PsychoCentral.com. And there is a www.helpguide.org.stress. And then there's a www.unr.edu. Thank you for your time.